Are you dealing with pain around your kneecap? Did you know that your pain may be coming from your ankle? So we're going to go over why your ankle plays a huge role when it comes to kneecap pain, otherwise known as patellofemoral pain syndrome. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. So let's jump into the topic of patellofemoral pain syndrome. So patellofemoral pain syndrome just means that we have increased abnormal forces in our patellofemoral joint, which is our kneecap joint. So there's two main joints in the knee. Well, there's three, but the main two that we're going to talk about is the tibiofemoral joint, which is your femur and your tibia. Then we have the patellofemoral, which is your kneecap and the femur bone, and it sits in that groove. So whenever you bend your knee or whenever you extend your knee, your kneecap moves. Your kneecap moves up and down and side to side. We have a whole video, if you click the description below, on patellofemoral pain syndrome. But the reason we want to introduce this is because that's in a kind of segue to why the ankle plays a role. Because the kneecap is situated between that tibia and femoral joint. It's floating kind of above, right in front of that femur bone, so it's in that groove there. That kneecap, whenever we do any movements, it's moving and it's getting loaded, especially when we bend our knee or do any movements. So when it comes to that, we need to start looking not only above the joint, which we normally do, but also below the joint, which is the ankle. And that's one thing we're going to dive into right now. All right, guys, so when it comes to the ankle and knee pain, so we talked about, here's your ankle. The main things we want to look at the ankle when we're dealing with the kneecap pain is the strength, the stability, and also the mobility. And we're going to break each topic up into those. So first part is the mobility. The main things is that dorsiflexion range of motion. So ability for your ankle to bend forward. So if we don't have good dorsiflexion range of motion going this way, what's going to happen is that my knee's going to have to do more of the work to bend forward. And then that's going to put a little bit more stress in that kneecap, which may be causing your kneecap pain. Another thing too is if we don't have good dorsiflexion range of motion here, bending forward, whenever we're going to do any landing movements or any other movement like a squat or even going down the stairs, we can't keep our heel down. So now we're, like we mentioned above, more stress above in the kneecap. So not only when you're jumping, playing sports, but just everyday activity like going down the stairs or anything that require good dorsiflexion range of motion. So that's the first one with dorsiflexion range of motion. Another mobility aspect of it is that if you don't have good dorsiflexion, what's going to happen is not only you're going to compensate by trying to use your knee to a little bit more by keeping your heel above the ground, but a lot of times that we see is we see overpronation. So if your ankle can't bend forward this way, it's going to try to come inward. So when our ankle or foot pronates inward, as you can see here, it's going to turn this way. This bone, the tibia, is going to internally rotate, kind of come a little bit more inward, and that's going to cause rotational forces at the knee joint and might put a little bit more stress in the kneecap when you're doing normal movements like a squat. And you'll see that, or lunge, when people like their knees come in, a lot of the times it comes from the ankle. So if you don't have good mobility, it's going to start coming inward and cause that valgus on that knee, which is going to cause increased stress in the kneecap joint. All right, guys, the next one, we talked about mobility. The other thing in the ankle is stability. So if you have a history of ankle sprains, that's one thing we tell people, hey, have you injured your ankle? A lot of basketball players sprain their ankle when they start having knee pain. Not only does mobility get affected, but stability. What happens is now your ligaments are impaired. You might have haven't worked your stability, meaning your proprioception. Now your ankle's a little unstable. So we're either overpronating or over-supinating. So our ankle now, we're not on a flat level surface and a good stability portion. So we're trying to compensate by either going out this way or going out this way. And then what's going to happen is this foot is going to rotate inward or outward, and that's going to cause rotational forces in the knee joint. So that's not as common. We see that with, chronic ankle instability or with recurrent ankle sprains, but the mobility is one of the most common ones. But this is one that we also have to take note of, especially if you have a history of any ankle sprains. All right, guys, the last point is strength. So the big muscle groups are going to be the calf muscle. So I can't stress this enough. People don't realize that whenever you land from a jump, or even when you're going down the stairs, or even walking, your calf is working eccentrically. It's working, this calf muscle. And if you don't have good strength in the calf, that's what impairs the ability. So when the forces get absorbed whenever you're doing any activity, like jumping, running, or playing basketball, all the forces are now going to go to your knee. The knee has to work even more. So that's why the calf has to be strong enough there, because that's the first point of contact whenever we land from a jump, or even when we're going down the stairs. We want to use this calf muscle to eccentrically control our tibia translation going forward. So a lot of the times we do a simple calf raise test, and you'll be surprised how many people can't even do 15 calf raises. So if you can't do 15 calf raises, now your calf is not adequately strong enough to go through the activities that you're normally doing. It could look big enough, but it's not strong enough to do those calf raises, and that's going to affect the ability to absorb force and do those activities without increasing that stress on the kneecap. So that's another aspect of looking at the ankle. All right, guys, so we went over why you have to look at the ankle when it comes to kneecap pain. So we went over mobility. So guys, remember, if you don't have good dorsiflexion range of motion, more stress in the kneecap joint here. Also, when we over-pronate here, because we don't have good mobility this way, we rotate here, the tibia rotates. Now we have a little bit more inward rotation, causing a little bit more stress in the kneecap joint. The second portion is the stability. Too many ankle sprains are going to cause an unstable ankle. Then the knee is now forced to compensate because we have a lot of rotation here in the tibia to compensate for that instability. The third one is the strength. We need to have adequate calf strength, gastroc and soleus. So doing those calf raises are going to be huge, because you'll be surprised how much of a role they play when absorbing force from landing from a jump or running, cutting, or playing sports. If you guys have any questions regarding patellofemoral pain syndrome, comment below. We'll try to answer them. If you need help with your rehab, we work with clients online and also in Southern California. Send us an email and see how we can help you. Hit the like button, share this video with friends and family, and also don't forget to subscribe. We are the Basketball Doctors. Let's ball for life.